Good afternoon, everyone. We are just going to give a minute for everyone in the waiting room to come in, and then we'll get started. Good afternoon. My name is Mercedes Witowski. I am the Executive Director at the New Jersey Council on Developmental Disabilities. Let me start off by thanking Assembly Majority Leader Greenwald for his commitment as co-chair of the New Jersey Legislative Disability Caucus and for taking the lead in this afternoon's discussion on housing access for people with disabilities. I'd like to also thank and welcome the other co-chairs and their staff, Senate Majority Leader Ruiz, Senate Republican Leader Bucco, and Assemblywoman Dunn for your leadership of this caucus. Thank you also goes out to all members of the Senate and Assembly who are members of the caucus and to your staff. Today, we see here Assemblywoman Murphy, Senator Corrado, Assemblyman McClellan. I'm looking around my screen. I'd like to welcome you all as you join and your staff. Appreciate your participation in this conversation. I want to also let you know that this session is closed captioned and has sign language interpreters available. And the session is recorded and will be able to view on the New Jersey Legislative Disability Caucus webpage. You should be able to find that link in the chat today. On the website, you'll be able to locate members of the legislature who are caucus members and the supporting organizations with their contact information and a little write-up about them. We encourage all legislators and staff to reach out to those individuals and those organizations on topics as they come across your desk. On the website, you can also sign up for mailings, emails, alerts, and submit comments or questions on today's topic or any topic important to you. See Assemblyman Spearman, Assemblywoman McCoy, Assemblywoman Fantasia. Thank you all for joining us today as well. I see more of you coming on. This Disability Caucus is a bipartisan forum within the New Jersey Legislature for lawmakers and your staff to consider all the impact on the disability community and all impact that faces people with disabilities in public policies. The caucus sessions are a place where we begin the discussion, and then in between meetings, there's many opportunities for additional conversations so that people with disabilities and their complex needs can be understood when creating policy. We know that people with disabilities, their families, and the organizations that serve, support, and advocate for them are a resource for all of you, and we appreciate when you reach out to them. Also see Assemblywoman Dunn's office represented today, Senator Bucco's office, Senator Deegan's office, and I'll tell you with disability focus on housing, I'm not surprised that this is our third discussion since forming the caucus on disability, on housing as an issue. We know that affordable, available, and accessible housing has an overall impact on health, safety, and security for all people, and stable housing certainly improves health outcomes and decreases the overall healthcare costs. So I'm delighted that we're continuing this conversation. We've done a great deal in New Jersey, but we always can do more. Please join me again in thanking and welcoming Assemblyman Greenwald as he shares two of his housing bills and his passion for additional housing options in New Jersey for people with disabilities. Assemblyman Greenwald, great to see you. And thanks for being here.
Thank you, Mercedes. It's great to be back together for our first Disability Caucus meeting of the new year. I want to acknowledge my fellow co-chairs, Assemblywoman Dunn, Senate Majority Leader Ruiz, and Senate Minority Leader Bucco. Their partnership and commitment has helped make this important work become a reality. I think it's a sign of the bipartisanship that we can do in New Jersey, and I think that more people would like to see around the country. Today's discussion is part of an ongoing conversation that we've been having about this critical shortage of housing for adults with disabilities, as Mercedes has alluded to. Like many of you, I frequently hear from aging parents who are deeply worried about their child's future, where they will live, and who will care for them when they're no longer here to provide the love and support that so many children need. Last fall, we had a great conference at Rowan University, spearheaded by Mark Magyar at the Sweeney Center for Public Policy, where at that seminar, we were able to bring together providers, parents, housing developers, and government leaders to explore innovative housing solutions to address the varying needs of individuals with intellectual and developmental disabilities. There were some excellent ideas that came out of that discussion, and I want to bring those back to this caucus today to keep the conversation going, and most importantly, to turn those ideas into action. One key takeaway from the conference was that while group homes work well for some, families need more options, especially for individuals with severe developmental disabilities and behavioral disorders. Many families have told us they need housing models that provide a higher level of supervision and support, like campus-style settings where services are centralized. This approach benefits both residents and providers by improving efficiency and quality of care. But right now, this type of housing doesn't exist in New Jersey, leaving families with few choices. Some are forced to place their loved ones in nursing homes, which are not designed for their needs, or keep them at home, often without adequate supports, putting both the individual and family at risk. Another major challenge is that housing is currently tied to service providers, limiting families' abilities to choose the best care for their loved ones without uprooting them from their home. Disability housing has long and storied history, from developmental centers to the 2014 CMS final rule and subsequent 2019 guidance on home and community-based settings. These have changed so much in the disability housing landscape, even in just the last few years. So I'm thrilled that we have the expert with us here today, Jonathan Seafried, the Assistant Commissioner at DDD, to break this down for us and help clarify what types of housing can legally be developed and how we can create new housing models within the existing regulatory framework. And I think it's important, as we talk with Jonathan, as we understand what is legal today, doesn't mean that that doesn't need to be modernized, that with the change in research and technology and science, that we're finding better ways. You know, we did a lot of this to break away from what was considered institutionalized housing. But today we are finding more of this campus style living is what families need, and where their children can thrive better in an environment in the community where they are integrated in that community in real time. So at the core of this crisis, though, is the supply. There simply aren't enough affordable housing options. Many people with disabilities have housing vouchers, but still struggle to find an accessible place that they can afford. I've seen firsthand how difficult it was for my own daughter, who is starting her career as a young lawyer in a great firm with a stable income, to find an apartment within her budget. So I can't imagine how difficult it is to be, and how difficult it must be for someone on a fixed income. But there are opportunities to expand our state housing supply. You don't have to drive far in our state to see abandoned shopping malls or office parks that were once a bustling center of commerce, but have now become abandoned and eyesores in our community. That's why we introduced Assembly Bill 2757, which allows developers to convert vacant office parks and retail centers into vibrant mixed-use developments. Mixed-use housing presents an excellent opportunity for individuals with disabilities to live independently and be active participants in the community by living in walkable areas with convenient access to jobs, transportation, and amenities. I also know that one of the biggest challenges for developers who are interested in building housing tailored to individuals with disabilities is access to capital and finance. That's why I'm glad to have Rosie DeFonseca, Assistant Director of Multifamily Supportive Housing and Lending at the New Jersey Housing and Mortgage Finance Industry Agency, here today to walk us through the available funding streams and provide insight on how we can tweak existing programs to better incentivize these much needed developments. Another way we can expand housing options for adults with disabilities is by allowing them to remain at home longer while still fostering independence through accessory dwelling units, also known as in-law suites or granny flats. I love that last term so much. But ADUs are small, self-contained units built on the same lot as a primary home, offering an ideal solution for adults with disabilities who want to live independently while staying close to family support. However, ADUs are currently prohibited in most of New Jersey, with only a handful of towns allowing them. That's why I'm excited to have Princeton Council President Mia Sachs with us today. She led the charge on New Jersey's first ADU ordinance, and she'll share her experience implementing it, as well as her personal story about how ADUs have helped her own family care for a loved one with a disability. Princeton's leadership has shown what's possible, but we need more communities to follow their example, and the state needs to help streamline this process in conjunction with the communities to not have this delayed by permitting and other roadblocks. That's why we've introduced Assembly Bill 4956, which gives municipalities a menu of options to increase their housing supply, one of which is through the ADUs. Before we open the discussion, I want to touch on one more critical issue, which is workforce development. We can build all the housing we want, but if we don't have a strong workforce pipeline, it really won't matter to these families. I know there are providers there that have beds available, but they can't fill them because they just can't find the staff. At the Rowan Conference, there was a lot of discussion about building partnerships between university programs and providers, ensuring that students are exposed to careers in this field early on and creating a strong pipeline of skilled workers. So please know that this is an issue that I'm actively working on, and I welcome your ideas. As always, our door is always open. Please feel free to reach out to my office, to reach out to Mercedes and the caucus as a whole. The legislature is an idea-based body, and we rely on your expertise to help shape the best strategies to address this crisis. Thank you for your time, and with that, I turn it back over to Mercedes and the rest of our program.
Thank you, Assemblyman Greenwald. You really have set the course for today, an impressive panel and absolutely incredible conversations, looking not just at housing in the traditional ways, but because it is not a one size fits all, but in looking at the different possibilities and expanding the way that we think. Before we move on, I'd like to welcome Senator Moriarty, Senator O'Scanlan, Assemblyman Chanal. District 11 is here with Jenna Lopez, Assemblyman Simonson, and Senator McKnight. I hope I haven't missed anyone. Oh, Assemblywoman Matsakodis, and Senator Ruiz's office with Erica Nava. We've got so many of our caucus members and their staff here today, so let's move right into the presenters and our panelists. I'm delighted to introduce our first panelist, Jonathan Seyfried. John serves as Assistant Commissioner of the New Jersey Division of Developmental Disabilities. In his decades-long career, he's centered on serving individuals with disabilities in leadership roles in many critical areas, including large-scale institutional to community transitions, establishment of portable housing subsidies, increases in direct support professional wages, which helps address the issue that Assemblyman Greenwald just raised on the workforce, establishing the first of its kind in the nation Office of Education on Self-Directed Services, again, another way to approach service delivery. Prior to that, John worked as a case manager for a nonprofit provider, and we're very pleased that he will discuss how DDD approaches and supports housing for people with disabilities in New Jersey. I turn to you, John.
Great. Good afternoon, everyone. Thank you for having me, and pleasure to be here today and discuss this important topic and provide information. So I'm just going to share my screen for the presentation, and we will get rolling. All right. So you already know me, John Seyfried, and I'm going to do a housing overview. And I recognize I have like 8 to 10 minutes, so I'm going to go at a pretty brisk pace to move through. So this is a very large, topic, and it's not the intention that this be all the information anybody ever receives. We're very open to, talking more about different areas. So that said, the division, we serve about 28,000 people in the community. Among other requirements, persons must be Medicaid eligible to receive services, and our services are provided through one of two home and community-based services, or HCBS waiver programs: our community care program and supports program. Since fiscal year 19, our enrollment in these division waiver programs has grown by about 27%. And this is based on the budget estimate in the corresponding fiscal year published budget. But what that means is in 2019, we had about 20,000 people enrolled in waivers, and today we have over 27,000 people enrolled in waiver programs. Another piece of important information is the division does not receive a federal match on funds spent on the bricks and mortar costs related to housing. We do receive federal match for the services outlined in our program service section of our manuals, our, again, community program and supports program. And pivoting over to housing and what we do with that, of the 28,000 people that the division currently funds housing for, about 7,700 of those reside in provider managed settings like group homes and supervised apartments. But about over 1,300 individuals have elected to rent a property directly from a housing complex and wrap services around themselves in those programs. This current fiscal year, which ends June 30th, we project we're going to spend about $58 million in state-only funding in these two areas. And compared to fiscal year 19, when the budget was $39 million for that, we've grown about 33% in that period of time in terms of the number of housing vouchers we support. So we division-funded payments for housing are facilitated through the Support Housing Connection using housing subsidies. Dwellings that SHC subsidies fund must be within published rent standards for the program and are not used in family-owned settings. And division housing subsidies are meant to be a bridge until a more permanent form of housing assistance can be achieved. An example of that would be through state rental assistance programs. But I want to stress there's no time limit on how long a person can receive a Supported Housing Connection voucher and receive that housing support, because we do recognize that waiting lists and availability for entrance onto other programs can be limited, and classically has been. So the Supported Housing Connection is made possible between the Department of Community Affairs, a partnership between the Department of Community Affairs and the Department of Human Services. Within that partnership, the division's housing subsidy team reviews eligibility and maintains subsidies for all people participating in the program. And the Supported Housing Connection administers payments, manages recertifications, and conducts inspections for rentals from private landlords. Individuals receiving housing subsidies, similar to other housing subsidy types, contribute 30% of their gross annual income towards their portion of the total monthly rent, minus any applicable deductions, and with the remaining amount covered by the housing subsidy, which is paid directly to the provider if it's in a group home supervised apartment, or landlord if a person's renting from a private landlord. To meet the diverse needs of the person served in our system, we partner with NJHMF, a New Jersey Housing Mortgage Finance Association, and also work to do requests for proposals for different housing options. Some examples of our partnership with the New Jersey Housing Mortgage and Finance Association is the support to support the development of special needs set-aside units and tax credit developments. That's a pretty common housing option that we have. And we also work with HMFA on projects that are financed through the Special Needs Housing Subsidy Loan Program, Special Needs Housing Trust Fund, and those that utilize Section 811 project rental assistance vouchers. And then we also do our own RFPs. We've done requests for proposals to create more capacity for of housing for individuals with acute medical and/or behavioral needs. We had an RFP that we put out last year to help develop housing to move people out of nursing homes, et cetera. So those are some examples of that. And as Senator Greenwald said at the top, he mentioned the HCBS settings rule. So we are funded our waiver programs. We get a federal match, which is at roughly 50% of the cost through the Centers for Medicaid and Medicare Services through our HCBS programs. And part of what the federal government requires, CMS, is that any setting that's receiving funding for home and community-based services has to comply with the settings rule. So what that rule basically means is that Medicaid HCBS programs need to provide full access to the benefits of community living and offer services in the most integrated setting for the person. Specifically, all settings where HCBS funds are utilized must meet the following requirements. So first, it has to be integrated in the community. Another component is the setting needs to support the individual's access to the greater community, including opportunities to seek employment, work in competitive integrative settings, engage in community life, control personal resources, and receive services in the community. Additionally, the setting needs to be selected from the individual from different setting options, including those that are disability and non-disability specific. The setting needs to ensure the individual's right to privacy, dignity, respect, and freedom to coercion or restraint, freedom from that. The setting needs to optimize individual initiative, autonomy, and independence in making life choices, including daily activities, physical environment, and personal associations. And the setting needs to facilitate individual choice and control for the persons that live there to the same extent available to those not receiving Medicaid HCBS funding. In addition to those requirements, because those are the characteristics of all settings, for those that reside in provider-managed settings, such as group homes and supervised apartments, the following are additional requirements. So the individual needs to have a lease or other legally enforceable agreement providing similar protections, have privacy in their unit, including lockable doors, choice of roommates, which is different than housemate, choice of roommate, person they may share a bedroom with, and freedom to furnish or decorate their own unit, have the right to control their own resources and schedule, including access to food at any time, have the right to access to visitors at any time, and have a setting that in the setting be physically accessible. So, as Senator Greenwald also mentioned, our transition plan, this rule's been out for some time and it has evolved. In the original version of the statewide transition plan, which was the state's submission to CMS into how we're going to comply with that HCBS settings rule, housing options for new sites were viewed as inflexible. There were density limits on the number of people with intellectual and developmental disabilities who could be served in new programs, and a direct prohibition on certain housing models, including campus-based settings. In the Murphy administration coming in, we recognized at the division that rigidity did not lend for solving for the unique needs of an individual with IDD and made changes to allow for innovation and flexibility. So what that means is today the size, this is just an example. Today the size of a site is no longer the sole determinant of compliance with the rule. To support that, the previously proposed state density review was replaced with the community integration review. And that looks at a variety of factors, including individual experience. And I want to stress that, the individual's experience, in determining whether the individual is integrated into the community based on their needs, interests, strengths, and dreams. So as Mercedes said at the top, it's not one size fits all. It's not everybody needs to be out in the community X percentage of the time. It's the person needs to be integrated to the fullest extent that's right for them in their life. So when we look at those community integration plans, we typically look in areas to make sure that the provider is clearly addressed how the setting is compliant with all aspects of the rule. So examples of the things we look at is the service model person-centered. So it's not the person is, fitting into the model, it's it's that the person, the model is built for that person. Is the individual considering, is the provider considering, how each individual's personal needs and preferences will be met? How will individual residents be supported to ensure that they have the same opportunity for community engagement as others who do not receive Medicaid services? And does the setting ensure rights, choice, and tenancy protections? just winding down now. So with the flexibility created by our newly approved statewide transition plan, we've engaged with a number of developers and providers who are developing projects that fall outside our traditionally approved 4-person group home. And examples of that include housing integrated into larger development projects. We've partnered with a provider who's looking to build housing for those individuals who are ventilator dependent, and campus-based housing to complement the portfolio we already have in the state. And finally, for more information, because again, this is a snippet, we can't do everything in 8 to 10 minutes, but we have a lot more information. We have an HCBS statewide transition plan website that includes, I singled out 2 guides, but all the information on that site's important. But the 2 guides are a provider's guide to the HCBS final settings rule, and innovation in housing, developing HCBS compliance settings. And then we have our HCBS help desk for any questions. And that concludes my slides. So thank you all for your time. And I'll turn it over to Mercedes.
Thank you, John. Just going to pause for a minute before we introduce our next panelist to see if there were any immediate questions from members of the Senate and Assembly or your staff. I know we just had Stacey Abdenstein from Senator Burgess's office join, and Assemblyman Barlis, and we also had Amanda from Senator Vitale's office. So did you hear anything in, John? I see a hand up. Sorry, I can't. You can unmute. I'm sorry, that's on the attendee side. So attendees, please go to the website that was put in the chat and send in any of your questions, comments, concerns. But thank you again, John. I know you're going to stick around in case something comes up as we move through. I'll move to our next panel speaker. I'm very excited to introduce Maya Sachs. Maya is the Princeton, New Jersey's Town Council President, where she also chairs the Internal Strategic Team for their Affordable Housing Planning and Redevelopment Committee. She is passionately committed to ensuring Princeton's continued evolution as an equitable, sustainable, and vibrant community. As Princeton's council chair, Maya is responsible for spearheading New Jersey's first accessible dwelling unit ordinance and speaks frequently around the state on this topic. She shares her experience about how ADUs are working in Princeton and any challenges that they face, and Maya's personal life blends with the ADU model. So Maya, we are very excited to have you join here today and look forward to all you can tell us about accessible dwelling units.
Thanks. Can you hear me?
Yes.
I always wanted to be a Maya, but I'm actually just a Mia, just so you know. So I don't have a fancy PowerPoint like my predecessor. I really just have my personal experience, my lived experience with my family in my community where I'm now an elected representative, and ADUs have been, so I'm just going to share that, and I'm open to questions, and I'm also available and very accessible to answer more granular questions from legislators who are interested in how we did what we did in Princeton. But just very briefly, Princeton had 2 sort of precursors to what is now our townwide accessory dwelling unit ordinance, and one was and as you know, we're also the only, well, I think there's now another one, but we were the only town in the state that consolidated. So we had a former borough and a former township, which further complicated things. In one of those, in the borough, we had a secondary residence ordinance that was sort of like an ADU ordinance, and then we had a flat ordinance in the former township. And they had many restrictions. They were better than nothing. And the year before I ran for council, which I think was in 2018, I went to the New Jersey American Planning Association conference and heard an entire presentation by the AARP New Jersey rep on the importance of ADUs and how they've been trying for such a long time to get their model, to get a ordinance, and ideally their model AARP ordinance passed in New Jersey. And I said, well, if I get elected, I'm gonna do that in Princeton, and we'll be the first. And 4 months after I got elected, we did it. We did that. Needless to say, I was giving it a lot of thought even before I was in office. And I just want to emphasize, you know, ADUs are, even though we have this new fancy term, this was a traditional form of the built environment. It's how families maximized the use of their property in the most flexible way for their family needs throughout the life cycle for thousands of years, until American post-war single-family zoning basically made what made sense illegal and made it expensive and cumbersome for people to use their own property for what made sense for their own families. And ADUs is basically about you know, resuscitating what had always been available to families on their own property. And, you know, I like to say it's great when life works out perfectly, but it hardly ever does for anyone. And often there's illness, divorce, loss of job or change of job status, change in financial status, illness, mental and physical disabilities. We all struggle with these things in our families. And then there's also just the naturally occurring life cycle of births and new children and getting old. And ADUs basically provide the flexibility for every family to accommodate these changes within their own property in the most cost-efficient, humane way, and to remain together on their own property and helping and being there for one another and meeting one another's needs in a way that current zoning in New Jersey does not make possible unless we make significant changes like Senator Greenwald is proposing with his legislation. So, you know, and I just, speaking to my family, I wanted to talk about, you know, how my grandmother, when she went through a divorce way back when women didn't get divorced in Princeton, and was a senior citizen, and it devastated her life. She had to move out of her own community and move 40 minutes away to her retirement community and drive back and forth to Princeton. This was actually before the, you know, Princeton then subsequently developed these precursors to the what is now our ADU ordinance. And fast forward to my mother, I'll say I guess we don't have a great track record when it comes to marriage. Although I'm still married. And so my mom, when she went through a similar marital situation, was able to remain in her own home as a senior, and because of her ADU, which, and I guess, you know, some of you have seen the New York Times article, which actually has a picture of my mom. And in that picture, you can see she was standing straight, and what you didn't see in the picture was her walker. The ADU enabled her as a senior to basically pay the taxes and you know, remain in her home. What we had not anticipated, and that was 2020, was that, you know, in the next few years, she would have a deterioration with her physical disability. She has multiple sclerosis, and my mom is now, as of in the last, you know, over the summer, she now is it's a 400-pound wheelchair, and you know, she needs assistance getting in and out of bed with just the most basic, you know, I know she would be fine with me sharing this, you know, toileting, all of those basic daily functions. And once again, her ADU is what's saving us, because we are now integrating that into her caregiver situation. And, you know, I think we're like many families in New Jersey that I like to call, you know, house poor. You know, we're really struggling with how my mom can stay in her home and how it is very expensive to have the care that she needs to stay in her own home. And what we are now working on is the caregivers that she needs will live, one of them will live in the ADU and will be on site. And it's just the creativity that is possible for us because of this ADU is, I really believe that every family should have that option available to them. And I'm going into this level of detail because I feel like you can talk about these things theoretically and how they're needed in the state, but it doesn't have the same impact as someone, talking from my perspective as both an elected official and, a daughter and someone who is very aware of, how much we pay in taxes and how difficult it is to age in place, particularly with a disability. So I just wanted to say that's my personal story. That's our town story. In terms of like basic facts about how we did our ordinance, we wanted to, and I'll say that after we passed our ordinance, I met with Montclair and Maplewood and a lot of other towns who were interested in passing similar ordinances. They are not seeing the same level of ADUs being created as we have in Princeton because there are too many barriers to creating them, like parking requirements and homeowner occupancy and age restrictions. And we basically got rid of all of those restrictions. I mean, we actually went even further. I think we are the only town that I know, one of the only towns in the country where you can actually, we allow for separate sale. But you do not need any additional parking. There are no additional parking requirements. And the way it works is you are allowed 800 square feet of the total square footage of the primary residence. You can either, or 25% of the primary dwelling. That's what you can build in as long as it's within the bulk standards that already exist on the site. And basically because we have like a center, sort of more urban, center of Princeton with small lots. And then we have like sort of a more, half acre and up to 4 acre size lots and in other sections of town. We really wanted to allow for maximum flexibility for families as they're, crafting their ADUs. I will say that despite all of the hysteria in Princeton that this was going to be a developer windfall, it is really the bulk of our ADUs are being used by families who are creating them for either older parents are moving into the ADU and their young family is moving into the main house, or whatever it is, using it with changes in the life cycle. And I think, did I use up my 8 to 10 minutes?
Boy, we could probably do a really deep dive on this, and I would love to set that up for anybody who's interested. You've definitely given us a lot to think about. We are proud that Princeton was the first to create this ordinance, and I do think that what you've done is address that issue of one size does not fit all, and this is a model that can work for people with disabilities and many other individuals in our state. So let's put a pin in that conversation so that we can move on to our next panelist. But I do believe that I'm ready for a deeper dive in that conversation. I know that the New York Times article may not be available to everyone unless you have a subscription. So Mia, maybe we can figure out a way to get the highlights of that article to folks that have joined us today and might be interested in reading more. But we'll come back, Mia. I will thank you again for joining us today.
Yeah,
And
thank you
you're
so
on the
much.
hook now, Mia. So let me move to our third panelist today. We are very pleased to welcome Rosie Da Fonseca. Rosie is the Assistant Director in the Multifamily Supportive Housing and Lending Division at the New Jersey Housing Mortgage and Finance Agency. She has 20 years experience in the real estate and lending field. She has been with NJHMFA for 15 years, And in her role there, she supervises the processing of multifamily as well as special needs only rental housing loans. She has extensive experience in performing financial analysis of multifamily housing development mortgage applications and developing financial feasibility strategies in order to maximize the number of alternative solutions available for a project's financing. She's so knowledgeable in tax credits and special needs only funding, in home funds, disaster recovery funds, you name it. Welcome, Rosie. Please take the floor.
Thank you, Mercedes, and thank you everyone for allowing me to join today and be able to provide you with an overview of New Jersey Housing's Special Needs Housing Trust Fund. I'll share my screen so that you can see a PowerPoint that we've created regarding the Special Needs Housing Trust Fund program. So the Special Needs Housing Trust Fund program is a key NJHMFA program that provides permanent and supportive housing for special needs population. Our program provides capital financing in the form of cash flow loans to experienced and qualified housing sponsors. For special needs only projects, the maximum loan amount per project cannot exceed $4 million, nor can it exceed 80% of the total development cost. For mixed income occupancy projects, the maximum loan amount for special needs units will not exceed $150,000 per unit. The Special Needs Housing Trust Fund program can be used for land and building acquisition, the construction of new units, and the rehabilitation of existing units. The funds cannot be used for rent and operating subsidies, supportive services, non-special needs units, age-restricted units, or units for residences or earning over 80% of area median income. Building supportive housing is an integral component of NJHMFA's mission to build affordable housing that meets the needs of vulnerable New Jersey individuals and families. That's why we're so proud of the impact the Special Needs Housing Trust Fund has had. Since 2005, 214 projects have been funded, 3,874 affordable homes have been developed, 1,354 ongoing jobs have been supported, and $1.48 billion in total development costs have been funded. The special needs populations that have been able to utilize the units that have been created in the Special Needs Housing Trust Fund include individuals with mental illness, individuals with physical or developmental disabilities, individuals in other emerging special needs groups identified by state agencies, victims of domestic violence, ex-offenders and youth offenders, youth aging out of foster care, runaway and homeless youth, individuals and families who are homeless, disabled and homeless veterans, individuals with AIDS, HIV, individuals in treatment for substance abuse, and individuals 18 years and over transitioning from nursing homes. The application process for the Special Needs Housing Trust Fund includes the submission of a $1,000 application fee, along with required documentation listed on this slide. Our unified application is basically the NJHMFA financing application that's available on our website. Along with that application, we also require that you provide a project narrative detailing the project and a scope of work if rehabilitation is being done. Our budget is called the Pro Forma Form 10, and this really reflects what the sources and uses for the project are. We also require resumes for the sponsor, along with evidence of site control that can include a deed, option agreement, or contract of sale, preliminary drawings. We would also require that you provide financing commitments for any outside funding sources that you reflect in your budget. If it's a multifamily project, we would require a resolution of need. We also require that you provide a social service plan that identifies the target population and service provider and evidence of the social service agreement. If rental assistance is being provided to the tenants, we would require evidence of that. We also work in conjunction with the New Jersey Department of Human Services Division of Developmental Disabilities and require a letter of support from them. This letter really lets us know that the setting being provided has been reviewed by the Division of Developmental Disabilities and is deemed acceptable. For special needs only developments, an opinion from the Developers Council that units may be leased to the tenant population. And NJHMFA also provides a special needs application design checklist. This is a questionnaire that walks the applicant and their design team through a series of design issues that must be considered and addressed in order for the project to receive funding. It's really a tool that's designed with the end user's special needs in mind. And for special needs only projects where the maximum allowable funding is 80%, of the total development costs, we do require evidence of the 20% non-NJHMFA capital funds being leveraged in the deal. After the application is submitted, you'll work directly with the credit officer at New Jersey Housing and Mortgage Finance Agency that will work you through the process, review the budget with you, explain any questions that the agency might have, review documents and any questions we have. We have an architectural team that will review the drawings and make sure the units are appropriate for the targeted special needs individuals. And we'll work with you to develop a timeline so that you can be presented to our board for a commitment, and then work with you to get to closing for the project. So it's a process where we'll hold your hand throughout the process and explain it to you in detail so that you're not lost at any point in the process. I wanted to highlight some successful projects that have been able to benefit from the program. The first one on the screen is Fairlawn Campbell Supportive Housing. This project was developed by BCUW Madeline Housing Partners, and it's located in Fairlawn, Bergen County. This project provided 6 special needs beds to individuals with autism, and we were able to provide $857,000 in special needs housing trust funds. The next project is an example of a project that included multifamily units and a set aside for special needs units. This is Project Village, Freedom Village at Hamilton Woods that was developed by Project Freedom. It's located in Hamilton, Mercer County, and it included 72 units with 18 units set aside for special needs individuals. Those units were set aside as 10 units for individuals with developmental disabilities and 8 units for individuals with mental illness, and we were able to provide about $1.3 million in funding. And the last project is Barclay Street Housing. This project was developed by New Jersey Community Development Corporation and Community Asset Preservation Corporation. It's located in Paterson, Passaic County, and it included 56 units with a set aside of 10 special needs units that targeted a population of individuals with mental illness. We were able to provide $1 million in special needs housing trust fund. This project is also a project that we were able to fund with our hospital subsidy program, which creates affordable housing developments on or near hospital campuses with a supportive housing set aside. So we were able to partner with St. Joseph's University Medical in order to create this project. Thank you for attending, and I just wanted to list the multifamily team that will be here to help you if you have a project that you'd like to develop or have any questions regarding the Special Needs Housing Trust Fund. Our managing director is Tanya Hudson Murray, and our division director is Donna Spencer. And of course, I'm always available if you have any questions or want to set up a call to discuss a potential project that you might have in mind. Thank you.
Thank you, Rosie. It's great to see the Patterson project in one of the projects that you've highlighted. I think it was the first housing discussion at this caucus where that model was being presented as mixed use near the hospital, where many individuals were overutilizing the emergency room, yet what they really needed was affordable housing. And so it's great to see that that project is one that you highlighted today. It just kind of feels full circle here. Are there any questions for any of our panelists at this time from members of our legislature or staff? A lot to digest. I believe more conversations.
Ladies, I'm sorry, this is Lou.
Please, thanks. Go ahead.
Rosie, is there the projects there's 6 autism beds, maybe 17 beds in another situation. We've had developers express interest in building campus settings like graduate school housing. So quasi independent living, staff on site, community living, resident being able to have kind of like I don't know what the right phrase is, but an apartment, 1 bedroom or 2 bedroom apartment that they might share, but a level of independence with like a little utility galley type kitchen, but community area where they go every day, and then a community center recreation area built on top of like typical graduate housing that you see at the College of New Jersey or down at Rowan with some of the really interesting development that they've done down there, where it's on top of pizza shops and gymnasiums and barber shops and salons, and, bringing the resident to the community and doing housing that would set up maybe 3 units of 30 units in a center. So in one location, maybe 90 units. And there's been pushback from the state say, oh, that's congregate living. And I disagree with that. I don't think that is congregate living. I think that is a new modern version of independent living, which saves. The one thing that really resonated with me was, as opposed to when they go out for daily activities, which many of which is right below them, but this one group was taking patients with traumatic brain injuries down to Ocean City once a week and working with the lifeguard community down there to experience going to the beach. And this would go on for months at a time, just like any other resident would go down for day trips. But instead of driving to Independent Rancher that had 4 or 6 beds and spending time going throughout the community to get them, they went to one location, were able to take the residents, put them on a bus and drive. That project got shot down and ultimately lost in New Jersey. Are we thinking, I know I threw a lot at you, but for the sake of time, are we thinking of modernizing this at all? Because I think our view of what is congregate living is outdated.
Yeah, that's a good point. Just looking at the Special Needs Housing Trust Fund, when this fund was created back in 2005, it was really created with the idea of not providing institutionalized settings for special needs individuals and really incorporating them within the community in either multifamily dwellings or group homes. And we work in conjunction with the New Jersey Department of Human Services, the Division of Developmental Disabilities. And I mentioned a letter of support that we require for each project. And that letter of support really lets us know that the Division of Developmental Disabilities has gone out to the site and determined however many units, whether it be 6 units in a group home or 10 units, that they're in a setting that would meet the needs of those special needs units. So I think now that we're modernizing the definition of what independent living is as opposed to institutionalization, we're always open to a conversation where we can work in conjunction with the Division of Developmental Disabilities to determine if those settings are appropriate for special needs individuals and have their best interests at heart. I think that's the main idea, is creating affordable housing with innovative ideas and being able to determine that the needs of the special needs unit tenants are really being met. And although it's not institutionalized, if it is a campus setting, that's something that I think we could all have a conversation about and kind of, as you said, modernize what that definition is. But for the Special Needs Housing Trust Fund program, it's really set up to fund, smaller group homes for special needs only projects, and then also incorporate special needs units into multifamily projects.
Yeah, and Rosie, in that situation, like, we lost that developer because they had 3 locations that they had identified that they were willing to go to. They had a property in Galloway. They were speaking with Mayor McCormick in Woodbridge, and then they were working closely with Congressman Pascrell, who had taken a real passion before he passed away on traumatic brain injury in Washington. So that would have given us a north, south, and central location. It hadn't been built yet. They wanted to build it, and they had the location in Galloway, and we lost that opportunity because we just said no. So I don't want to lose opportunities like that going forward, which is part why we put this group together. So, maybe that's something you and I can follow up on, because I think we need to, that type of living to me is very interesting as a parent. If I had a child in that situation, I would, if they fit medically and from an independent standpoint, the ability to have that, that's what that's the type of living that I would want them to be in if I could choose that. And right now we don't have that option. So I don't want to belabor the point and hold everybody up, but that's something I would like us to follow up on to see if we could create a model that would fit.
Yeah, that's definitely a follow-up conversation that we can have. We're always looking for ideas to create affordable housing that meets the requirements that the tenants need. And, in conjunction with the Division of Developmental Disabilities, we can always continue this conversation so that we can be able to create those units in the future.
Great. Thank you.
Thank you. Assemblywoman Matsoukas.
Thank you so much. I just want to jump off of what the Assemblyman was just talking about. I visited Mount Bethel Village in Warren, which is that type of living. I don't know if any of you were familiar with it and what you think of it. It was very interesting because it was that campus style living, and I found it very intriguing. All the residents were very happy, very engaged, and safe. Because that's what we need. We need everyone to be safe. So if anyone is going to be continuing the conversation, I'd love to be involved in that. So thank you.
Thank you, Assemblywoman. And John, do you want to respond to either Assemblyman Greenwald or Assemblywoman Matsakota?
Certainly. Well, we're very open to having conversations. We do fund units at Mount Bethel. We do currently have a functioning campus program in New Jersey. And there are ways that we can be innovative with the CMS HCBS settings rule. I'm not aware of the developer who was going to develop in 3 parts of the state, but we said no. So I'd be very interested in information about that and whether or not maybe that was during the Christie administration, because they had approached the HCBS settings rule in a much more narrow way. So I'm just, but I'm very interested in having conversations and seeing how we can move things forward, because we agree one size does not fit all, and we need to provide meaningful choice to people.
Yeah, and Jonathan, let me see if I can. That was a company that I was working on in a lot of the healthcare space. They had received. It was during the Murphy administration, just so you know. Unfortunately,
Okay.
It was. I would say probably 3 to 4 years ago, and unfortunately, the company had received a contract with Veterans Affairs nationally, and they were building this type of housing all over the country, and right on our doorstep in Delaware. And
were these units with no kitchens in them?
Jonathan, I don't know. I kind of remember. I would call a utility kitchen, right? Because some residents are capable of. I don't think that was. They were meeting with the state to adjust and kind of find out what the demand. But it was. They were told, no, we don't do this here in New Jersey. It's congregate living. They offered set up a tour for folks to go to Pennsylvania or Delaware and see what they had built. The response then, which I just drives me crazy as well, it's COVID and we're working remotely.
I'm not
the answer.
Yeah, I'm very, very happy to have a conversation, but I did not say I'm not going anywhere because of COVID during the pandemic.
Yeah, this is not critical to anyone on this call. But this is why I like having these calls, right? Because I think it's important for you guys to hear this, and that should never. I don't want. I know how hard everyone on this call works. My style would be, that's interesting. I want to learn more about that. How do we make this fit in New Jersey? What are other states doing that we're not doing? I don't want to see our loved ones having to send family members to other states because this is the way we do it. That should never be our answer. This is the way.
Absolutely.
Right.
Couldn't agree.
So anyway, I'll stop there. But Jonathan, maybe I'll call you offline.
Yeah, please.
Rosie, and I'll give you some more of the backdrop and we'll go from there.
Great.
Okay.
Thank you all for that. Yes. If we can solve an issue here, boy, then we've made everybody's day. I want to thank you all our panelists. Assemblyman Greenwald, thank you for opening up this conversation again around housing. Mia, you are still on the hook. Our next caucus session is April 22nd at noon. You can join us or watch the recording, but we appreciate your being here live. We appreciate all Senate and Assembly members and staff who've joined us today. Assemblyman Greenwald, any final remarks before we bring to a close? Okay, so then we are good to go. Thank you again, and we look forward to seeing you at our next session and in between where all the work gets done.
Thank you, everybody. Thanks again. Thanks, Mercedes.
Thanks.